Hey guys, this is your pharmacist Sidra, and in this lesson we will discuss Medicare and Medicaid programs. These are the two health insurance programs provided by the United States federal government, and as a pharmacy technician you must have a good understanding of insurance billing and providers. So stay tuned to get the understanding of these two very well-known programs, what they are and what they do. Medicare is a federally funded health insurance program given to people over the age of 65 as well as to people with disabilities who meet certain conditions or if someone has an end-stage kidney disease. Medicare was officially established in 1965 and is part of U.S. Department of Health and Human Services, and much of the funding for this social program comes from federal payroll taxes. There are four main parts of Medicare: Medicare Part A, Medicare Part B, Medicare Part C, and Medicare Part D. Part A is hospital insurance. It mainly pays for hospital stays, care in skilled nursing facilities. It also pays for hospice care and for some home health care. Medicare Part B is a medical insurance which covers doctor's services. It pays for outpatient hospital cares, medical supplies like your test strips. Also, it pays for preventive services. Medicare Part C is Medicare Advantage plan, and it refers to Medicare health plan that is actually offered by a private company working in tandem with Medicare to provide a person with both Part A and Part B, and many times it also offers Medicare Part D. Medicare Part D is a prescription drug coverage. Now, to help remember all of the points I just made, I like to break everything down in my head like this. Medicare Part D covers drugs. Medicare Part C includes contracts with private companies. Medicare Part B refers to bouts of medical problems on an outpatient basis, which is doctor's visit after which you kind of go home, while Medicare Part A refers to ailments on an inpatient basis, meaning hospital stays. Also, to help remember that Medicare provides care for elderly, try to think about the fact that as you age, you need a little bit more care than someone young. Therefore, Medicare is for elderly patients. Now, let's talk about Medicaid. Medicaid is provided to qualified individuals who meet certain income requirements. Both Medicare and Medicaid made up a large part of the federal budget. The two get confused so easily since they're so similar. So it's important that you understand that Medicaid is used as an aid by low-income people. More technically speaking, Medicaid is a federally and state-funded program administered by each individual state, which provides government insurance for people of any age whose income are insufficient to pay for health care. Like Medicare, Medicaid was also created in 1965. Initially, Medicaid was limited to families with low income as well as people with certain types of disabilities. However, when in 2010, the Affordable Care Act, informally known as Obamacare Act, was passed, millions of other Americans became eligible for Medicaid. Medicaid helps to provide millions of Americans with important health care, especially that includes children, people with disabilities, seniors, and pregnant women. In order to qualify for Medicaid, person must be under the age of 65. This is because that those over the age of 65 receive Medicare. Additionally, for an adult to qualify for Medicaid, their income must be equal to or under 133% of federal poverty level. Some states may use a figure of 138%, but it's just a rough figure. The exact salary ranges that qualify a person vary from one year to another. As of 2022, a person would need to make at least $18,000 per year or less in order to qualify for Medicaid. With regards to families, this amount changes depending on the size of the family. For instance, if there is a family of two, they would need to have a combined income of 24,000 roughly or less, while a family of eight would have to have a combined income of roughly 62,000 or less. While Medicaid is largely funded and mandated by federal government, individual states run most of this program. When one qualifies for Medicaid, they are usually enrolled in one of the state's Medicaid insurance programs. Some of these insurance programs are offered through private companies. The choice of plan or the choices of plans under Medicaid are usually very limited and are offered on the health exchange website for each state. The benefits offered under Medicaid differ from one state to another. Generally speaking, I would say Medicaid plans are required to cover hospitalization, outpatient services, regular doctor's visit, and prescription medications. Their copays are often zero, so that's a good thing since they are low-income patients. I know this is a lot of information to remember, but in one-line summary, if I may, Medicare is for people over the age of 65 and certain people with disabilities. Medicaid, primarily on the other hand, is for individuals and families with low income. That's the main differentiating point for both. I would say just watch the video over and over to really grasp the concept. And if you are still confused or have any questions, write them in the comments and I'll be happy to answer. And I hope to see you again in the next lesson. Until then, take care. Bye. Hey guys, if you found value in this video, give it a thumbs up, share it with your friends and family, and remember to subscribe to stay up to date on new weekly videos.